All right, so I'm gonna brand new conversation. What's up?
All right, so we've got a 44-year-old male on home dialysis who is currently unresponsive.
That's it.
Yep, that's what I fed into it to start with, to start the conversation.
All right.
And one of the things that so obviously, last night I was very short-handed. I wasn't able to pull my phone out and do this, but one of the things that I like about this, and like Mark was talking about, the way it always tells you how it came up with the calculation,
Yes.
is being able to, in the moment, like when I'm getting reported or whatever, doing an IFT, or if I'm getting report from a provider on scene, being able to just punch this stuff in and let the AI do its work in my pocket.
Yeah.
It helps with the cognitive offloading. I think that's one of the biggest things that I've seen as a benefit to this.
When you say
In the
cognitive offloading, for example, you mean like you're like at 4 a.m. in the middle of a hospital IFT and like you're so tired you don't even know what to do with yourself.
Exactly.
And it's like
Exactly. Like, I'm at a hospital. I've got a critical patient that, they're bleeding or whatever. They're on a vent, and I've got, you know, I am. We all know that feeling of six people are taking care of this patient. Now I'm going to get in the back of the truck with an EMT that started yesterday, and I have to manage what six people were doing. Being able to use this tool to cognitively offload things like calculations and um, warning signs and stuff like that. It that to me is the biggest value of this, aside from the 30-year-old medic standing over my shoulder, is just being able to offload things like math.
sure.
Yeah.
Yeah.
So let's see what we got here.
Yep.
Based on the information provided, a 44-year-old male on home dialysis is currently unresponsive. The situation raises significant concerns, and it is crucial to consider potential causes and appropriate interventions. Firstly, it is essential to rule out or address any life threatening conditions such as severe hypoglycemia, cardiac arrest, or stroke. Given the patient's home dialysis status, it is also necessary to consider dialysis related complications such as disequilibrium syndrome, hypotension, or access related issues. Given the patient's unresponsiveness, it's necessary to initiate advanced airway management techniques such as intubation to secure the airway and ensure adequate oxygenation and ventilation. Simultaneously, initiate cardiac monitoring and evaluate the patient's hemodynamic status. Considering the patient's home dialysis status, it's essential to access the dialysis equipment and machine for any to assess. I'm sorry, the dialysis equipment and machine for any malfunctions and alarms that may provide clues to the patient's current condition. Additionally, note any clinically relevant values on the machine's readouts, such as liters removed, for further evaluation. Given the patient's unresponsiveness, it is essential to initiate comprehensive evaluation, including point of care laboratory testing such as serum glucose, electrolytes, and complete blood count. I don't know many people that have that on the ambulance, but if you do, good for you.
Yeah.
To assess to assess for any metabolic or hematologic derangements. Additionally, considering obtaining ECG and evaluate for potential cardiac causes and of the patient's current condition. Based on the assessment findings, consider advanced interventions such as fluid resuscitation, vasopressor support, or dialysis related interventions such as adjusting the dialysis prescription or addressing access related issues. In conclusion, the patient's unresponsiveness requires a comprehensive evaluation and advanced interventions, including airway management such as cardiac monitoring, laboratory evaluation, and potential dialysis related interventions. Is essential to address any life threatening conditions promptly and collaborate with medical control as needed. All right, so I'm going to give you some made-up vital signs. I'm not going to use the ones from the actual call, but
Obviously.
I'm going to give you some
Okay. Sure. Yeah.
similar stuff.
Yeah.
All right, so our initial BP is 68/32.
68. Uh-huh.
We are sinus on the monitor at 125 with flat T waves. Respirations of 20.
Uh-huh. Uh-huh.
SpO2 of 91.
Uh-huh.
And a blood glucose of 2, we'll call it 280.
Uh-huh. We send that?
Yep.
You want a question or you just want to send that?
Let's just send it because I want to see what it
Sure.
decides
I'm
to
just asking. Just
prioritize.
see what happened. Yeah.
Yep. I think so. One of the things that I would say about that prompt, honestly, is that again, I didn't give it a lot to work with. That wasn't conversational. If I ask it questions in a conversational manner, it'll do it. But if I just state vital signs, it's trying to have a conversation with me. Based on the information provided, the patient's initial blood pressure is 68/32, and sinus tachycardia on the monitor with flat T waves and elevated blood glucose are concerning for hemodynamic instability and potential cardiac ischemia. The patient's oxygen saturation also warrants attention. First, consider addressing the patient's hypotension and tachycardia. Given the patient's history of home dialysis, the hypotension may be related to volume depletion or complications from dialysis. A fluid bolus might be beneficial in assessing the patient's response to fluid status. However, the potential flat T waves on the ECG may indicate cardiac ischemia, which could worsen with fluid administration. In this situation, it would be reasonable to consult medical control for guidance on whether administering the fluid bolus or consider pressors to support blood pressure while also addressing the potential cardiac issues. Considering the conversation's history, the patient's unresponsiveness, and current query, a more focused approach is required. The patient's hypotension and tachycardia, along with ECG changes and elevated blood glucose, suggest the need for urgent intervention. Given the patient's history of home dialysis, it is crucial to assess for any dialysis related complications. In this context, initiating a fluid bolus might be a reasonable first step while awaiting medical control guidance. However, the patient's ECG changes and potential cardiac ischemia necessitate careful monitoring and consideration of pressors if fluid administration does not improve the patient's hemodynamic status. Regarding the patient's elevated glucose, it is essential to assess any underlying causes such as sepsis or diabetic ketoacidosis once the patient's hemodynamic status is stabilized. I love that answer
It's
because it gives
insanely
me
good.
a list of priorities. It's telling me this is what you need to be looking for when you do this. You know, standing in this dude's living room, I've got 7,000 things on my mind, and I've got a whole slew of problems in front of me. And and once again, that cognitive offloading of which one do I tackle first. You know, I know that in a dialysis patient, he's probably going to be volume depleted, especially if it happens during the dialysis. But being able to prioritize that, if I'm a brand new medic walking into this situation, man, that's a fantastic answer. I'm so happy with that answer. It's not even funny.
I know. I myself included.
Yeah.
Like I'm like what? Like that's a really good answer actually. Like really really good. Like yeah. Anyways, like yeah, that's how good this thing is actually. Yeah.
Yeah, it just gives you that next level of preparation
Yeah.
and
Yeah,
guidance,
I mean, do you want
and
especially
to?
at two
even
in the
just
morning.
what to expect.
Yeah.
Yeah, we kind of went randomly there actually, but that's pretty good.